Hi, I'm Larry Berger, and I want to introduce you to HealthBeats, Dashboard to Decisions. HealthBeats enables county government to be responsive to its population health needs by creating a common health surveillance and decision-making platform, driven by a range of actionable data. It also includes a touchpoint for community sentiment and promotes better health outcomes and improvements in the lives of county residents. Many counties, both locally and nationally, are not faced with a problem of paucity of data, but one of data overload. HealthBeats' aim is to solve both problems, bringing accessibility and order to valuable and credible data sources, knowing what is known, and highlighting data deserts where more data should be generated, knowing what is unknown. There is a lot of health data. What is needed is relevant, sensitive, actionable health data. In a time characterized by resource constraints, it is imperative for county government to be more efficient and effective in meeting its long-term population health needs. Expanded data resources, through which officials can gain valuable insights into the needs and priorities of the county, opens up data vistas, streamlines the process, and creates a vehicle for county-wide collaboration. This is especially critical for officials who may not have come to their positions with prior clinical, public health, or statistical expertise. The mind map shows how we aggregated data from multiple and disparate databases, including social media as well as other sources for determining constituent sentiment. The comprehensive decision-making support platform allows maximum collaboration and produces timely, actionable data, including those important issues which may be bubbling up from the community. Sources of data include local, state, and national resources that will enable the creation of relevant benchmarks to facilitate comparison of county performance on key metrics. HealthBeats gives you and county government a window to action. We're looking at a burden of disease slide, which has aggregated data for the County of Santa Clara. Allocating scarce resources is an important function for county officials. In the area of health, it is often complex, since there are many different activities and it's difficult to determine where to spend money effectively. One useful tool is to calculate the burden of disease, disability-adjusted life years, for each health problem and calculate the cost to prevent and the cost to treat each disease category. Our tool, HealthBeats, can automatically calculate the burden of disease for the county from county health indicators. It can access standard costs for each condition, and it can pinpoint some conditions which are high cost and low effectiveness to treat. Let's turn to the HealthBeats dashboard. Dr. Albert Lamb, a member of our HealthBeats team, will walk us through the dashboard.
Hi, thank you, Larry. I wanted to start off with the dashboard with the very first screen that, in this example, the county supervisor, Cindy, is looking at. You can tell she's from Santa Clara County, and at the very top, the very first thing that she sees is her ribbon of information. And at the top, she has health rank, budget, hospital census, crime index, unemployment, and air quality in her county. She can set these any way she wants. She can customize it and set alerts. On the middle part of the screen is the hot topics section. And you can tell that she's working on currently working on a budget analysis where she's tasked with cutting 10% from her county health budget. She has looked at the budget distribution as it is between hospital, clinics, children's care, and outreach. She also has a census of her county hospital. She's identified some areas to explore. And this includes low utilization clinics, and it also includes exploring high-cost procedures. In the middle right screen, you can see that she has the community concerns. And these community concerns are the word cloud here is drawing information from Facebook, Twitter, local articles that might be searchable on Google and Google Trends, and also the Santa Clara County government. And the text that comes up is sourced from there. On the bottom right, we have the collaboration tile. And this is really a key point or a key element of the HealthBeats dashboard, where we bring data to the point of decisions. You can see here that the supervisor Cindy is looking at comparing her county health rank to peers. She can also do so on a state and national level. And then something catches her eye on the right side. And what catches her eye is this word pertussis. She doesn't know necessarily what pertussis is, but she knows someone who knows. And that person is her director of the Department of Health in her county. And so she uses the collaboration screen to call him up and ask him what's going on and why is this showing up under my community concerns. So now we move to his screen, and he's looking at a different set of information. His ribbon is set up for information specific to his position. He's looking at the budget, of course. He's looking at the hospital census, but he's also looking at ER access times and readmission rates, the rates of uninsured patients in his county, and also the immunization rate. Again, he can customize and set alerts as he likes. His Hot Topics menu is populated by information on the uninsured rates in the county. Currently, 88% of the county is insured, and his analysis suggests that with the Accountable Care Act, that it'll drop from 12% down to 2.7%. But that's not important right now. What is important is that the county supervisor in the bottom right hand of the screen is calling him up and asking him about pertussis. So he punches that into the search screen, and out pops information populated from those very useful sources that we talked about before onto his workspace. And here you can see that there are tables, graphs, and maps showing vulnerable population, the trend of infection, and also the social media input that we had seen before. And then on the bottom left are also some search items that are being pulled up from the CDC and the Santa Clara County Public Health Archives, showing information that might be important to pertussis. So what he's going to do is this. He's going to actually drag and drop the parts of the data that he likes, that he thinks is pertinent, into the new topic page and create a new page for discussion. And he's going to go ahead and jot down some notes. He's found out that there are 5 new cases that were confirmed in the county, and because of that, he's going to issue a public health advisory. He's going to go ahead and click on share. And here we go back to the supervisor Cindy's screen. And you can see that the Hot Topics workspace now shows pertussis, including the report that her director of the Department of Health has given to her. Going back to the director of the Department of Health, Andrew, you can see that his report is also present on his workspace.
Thank you, Dr. Lamb. In order to illustrate what we think success will look like, we'd like to share some hypothetical quotes from public health officials after using HealthBeats. Our data used to be confusing and poorly organized for action. HealthBeats lets us know the real needs of our residents and allows us to quickly make collaborative decisions based on the data. And since our counties have adopted this tool statewide, we now have an easy shared platform on which to compare and collaborate with each other on key issues and better understand how to prioritize our programs. And finally, using HealthBeats to manage and collaborate on the use of county resources, we really feel we are making a bigger difference in the lives of our constituents. I don't have to spend 20 hours to understand where our health budget is. I just get on HealthBeats and I know right away. So in summary, leadership will be able to work together, sharing an executive dashboard, coordinating the efforts of staff in support of county goals in a more transparent and data-driven fashion. The range of data available to shared staff means that crisis management will be more timely and effective, along with an increased ability to manage budgetary constraints and reach the long-term health goals of the county. Thank you.